fumble them and call we IB blog. We always they appear for the news. Well, few weeks back, we do an interview with the manager for Sing and Dance and Tonobo. When one of the most popular trending star right now in the country, when a manager Jupiter, who say he be alleged say then send Ali Panam. Well, according to when we be done do the interview with he later come do test, then find out say, of course, na M-Pox na him be don't get. Well, IB blog as we na a responsible institution and we people them always rely on we platform. Well, we decide say because we na contact now, we decide say we say for come, of course, na EPI, one of the areas them way and they take the vaccine. Well, we been come and try for do a test on we. Well, we not get sick, but because una know say we all time day with the public, we always they go out there for make sure say we serve the nation. We always they interact with people them. So we self don't decide for take the vaccine. Well, of course, we there so with somebody we go come and tell we in name and in a expert, of course, na a doctor, they will come and tell we. For sake of the interview, sir, you can tell me your name.
Me na Dr. Desmond Mada Kangbai. Me na the program manager for the EPI, where they deal with vaccines, not only the M-Pox vaccines, but all vaccines in the country.
So take we through M-Pox. Take we through the M-Pox. How within the M-Pox they about right now?
Okay, well, first and foremost, I want to tell you boku thank you because we wanna safe can for take the vaccine, the maclet. And this morning, and I see wanna come around because the national surveillance then send una and as one of the contact them wanna be go interview somebody wanna not be no say na the M-Pox sick get but wanna interview and wanna be get some contact with the person and they send a list for more vaccinates wanna be get and we're really happy that wanna safe come and because wanna come wanna talk come people then go know say the sick day and also the vaccine good. So the M-Pox, of course, now is sick from January, don't they get, or even maybe before January, but now January really will begin to water. Now more than 1,500 people they don't get the sick, and mostly in the western area, urban and Freetown. And we believe say more people than they out there, just like the one wanna be going interview where not be know, go there they will not know where they feel say now other witchcraft or now other sick them. So and it really very serious. Then they come up with fever, they get that rash. That rash now more they call attention. Because we don't see the rash, they come on a different part than at the body. And because of that rash, the way people they don't they see where they affect the genital regions them. They don't make people they don't afraid, they sick.
And so what do they cause the M-Pox?
Well, the M-Pox na a viral disease, na viral disease where na is zoonotic na from animals them to humans them. And of course, really on be done, I think several years back we get one case I feel saying a Pujian, but no other case they not become, and I think say another case become when I do go after that no other case. So this not the large scale, say don't they happen in other Boku countries like Congo, I think say even Liberia, Guinea, we don't get some cases then. So it don't they spread, but we they do we level best from up we see how we go control the disease.
What are some of the signs and symptoms?
Well, the signs and symptoms they can get fever, headache. But mostly na the rash more where don't they call a lot of attention where they produce the rash, the generalized body rash where they see the common people then at their face, their head, their hand, them, their whole body. And I believe say we all don't see pictures that even na the genital regions they don't see pictures where they come up at people then and then genitales how the rash they come out there and I think say and when I see when a colleague when I be going to interview the different rash. So now some of the symptoms and then the body rash now the classical symptom where people then they get all they see we don't make all man afraid the disease.
We don't get diseases them now like the corona, the Ebola way. Then get similar symptoms, the fever, the disease. So within a one key sign way indifferent from that we person will see no say being this now M-Pox.
Where the M-Pox and most of them are viral, they get similar signs and symptoms, but one of the classical signs of the M-Pox now the rash. That body rash. We know so COVID will not be the talk about rash. No, so have more cough, runny nose, that have respiratory symptom. Ebola, of course, people that they get fever, some they can get rash, but not to this classical rash when a big rash, they wear some even turn like pus where they produce that bad water. Nice. So now that rash, big rash, they even we see the rash, it different from people that say we can get that pimples na their face. No, so it different from the Peking that can get measles. No, so the rash now really the classical sign where they really they call to attention. But anybody where they complain sick, you get fever, you get small rash. Some people then they the rash now knocking the all over the body. Now that genital region, that private part then are they in there. So that's if so sometimes there's some people that they can get out their private region or they not their body. You not go know. So now I make people themselves where they see now, they complain, say they know well. They find for more people check there, they get fever, they complain. All that small, I find more check there. Maybe well body people then check there and do tests for sure, say whether not M-Pox or not to M-Pox.
Okay, away from that, let we come to the vaccination process. How the vaccine process they go?
Well, so far the vaccine process they go fine, and the demand for the vaccine is really very high, and we can really and feel when people then they come, they want the vaccines but not able to get the vaccines, but we can talk to them because the vaccine are one component of the preventive measures. They like okay, no more avoid handshaking, avoid body contact, avoid crowded places, go they wash your hand with soap and water, sanitizer if somebody sick report. So vaccine are one of those components the way instead they prevent people them from the sick. But now the way the sick don't go, the vaccines they really make we don't take a strong decision where and we self me self can feel embarrassed sometimes where and even colleagues, other people that you get for refuse them. But sometimes we want for break the chain of transmission. So now we dey focus more on the contact, just like una. When una come, una bring something wey show say una na contact dem, una comot from surveillance. We not refuse una no so we give because we want for ensure say the one that we don't get contact, we give them the vaccines so that they not go get the sick. And if una not get the sick, una not go spread them to somebody. So now we dey follow people that will side the case then. So surveillance they tell we say we get this number of cases that we don't line list the contact, then I add them there, and then they go with the vaccine team, then go give those contact then and vaccine so that they go protect we all so that the signal will continue for spread.
So wetin are you message to people and we go on for misconcept say the vaccine right now because of people and they go get enough or some man can say now because of then they pay for them and other people go and say then they when they go to hospital and they ask them for money. One for like clear the air.
Well, the vaccine absolutely not free. Anybody wey eligible for the vaccine, for example the healthcare workers dem, the healthcare workers dem na be with top priority for the vaccine, but that sef don reduce small because we dey look at the epidemiology of the disease, and based on the epidemiology currently healthcare workers dem na few dey get the sick few. So now we don really dey focus on the contact. The contact then are our priority. Anybody with surveillance line list and say now the contact, now then our priority for giving them the vaccine. We also get and sex workers then because don't see say there's some sort of sexual transmission. So we also they follow up and vaccinate the sex workers, the sex workers. We also they look at people living with HIV, some certain group, because we also don't see say some of them we don't they die na them, and we want for ensure say we honor Sierra Leoneans them irrespective of your condition. Now with brothers that we all just like the sex workers there. So we want for ensure say those groups then they move and ensure say they are safe. So we they give them the vaccine. Even healthcare workers, the way they work on outpatient there, they work at the treatment centers there, they safe now priority there because anybody who is sick now outpatient force they go no so and now there you get chance for contaminate somebody. So the vaccine absolutely not free. Nobody not for pay 1,000 a single cent for take the M-Pox vaccine. And we said they'll go ahead, they listen, they monitor people then. If we hear anybody they sell the vaccines, we will take all the actions against them. If anybody say it go some side and take the and they ask them for pay money, make more we know. This nothing where the government of Sierra Leone they against, we minister they against, nobody not for sell vaccine and vaccine are free. We don't dey give childhood vaccination are free. We don't dey give Ebola vaccine. We don't give COVID vaccine. All vaccines so can give away the government they buy through in partners then are free.
Let me look at the age limit of people that they take.
Well, for now,
yeah. Take me to.
For now, we dey give vaccines to people then with the 12 years and above.
Wow.
For now, picking them 12 years and above now.
So below 12 years.
We'll not dey give them the vaccine for
Why?
now. And well, and with the still and new vaccines then. So there's still a lot of studies ongoing, and for looking at the vaccine, what will be the effect of the vaccine in picking them. So we self and they follow on those and studies them for see if there will be changes. And also based on the epidemiology of the disease, if we see say and there's a lot of cases among picking them, these are things we will sit down, we look at the data, we don't generate, we look at data with other countries, then we don't generate, we sit down with partners, and especially the Pharmacy Board of Sierra Leone and the National Immunization Technical Advisory Group, we sit down with them, we look at that data, and then we can change. When COVID began initially, we would give 18 years and above. Later, as we dey go, we bring am 12 years and above. Other countries, they also later give pikiness. So we dey look at we own data in cases, and based on that, we go take an adequate. And also, we not dey give belle woman dem. We not say also give lactating mothers dem for now. But also again, these then are things that as the outbreak they go, we can sit down with with technical bodies. Then we look at the data, we analyze them, and then we take an adequate and considerations. So recently, we President and His Excellency President Madabio be meet with the Gavi CEO, the people that can help with vaccine. He talked to them where they become in country last week for me to help with more vaccine. So they be promising yes, then go support the
So the
country.
vaccine not enough
Then
right
go
now.
right now not enough.
Okay.
But they be promising yes, then go support the president with more vaccine. So we don't begin that work that application writing for more ensure say more bring more and vaccine. And we minister self, they push very hard. They don't get a lot of meetings for more we ensure say more we get more vaccines in the country.
How many days it go take where somebody gets contact with the disease, or where he gets away go show say yes this person don't get a quick one?
Well, normally the incubation period they go up to 21 days. So we dey monitor the contact then for that during that period. For more we see, sometimes even before 14 days, some man don't begin present with signs and symptoms. So again, an incubation period, we dey monitor the contact then for more than see if then get any sick, they develop the sick. And also again, the earlier we give you the vaccines, the better. You understand? So once you don't get the contact, we need for ensure say we give you the vaccine quick so that you not go develop the disease. Or even if you don't take the vaccine, if you dey develop the disease, you go develop many more because the vaccine they highly protect people there. But also again, possible say you can take the vaccine, you still get the disease. But now in that case, if not something way for don't severe, it will just be something really very mild because it get a very good efficacy where they don't check. But so if not something the effectiveness really very high, the vaccine effectiveness. So if not something way for don't give boku rush or kill yourself or do this, it go be very mild that you not go even feel it will just pass off easily. But the vaccine they protect a lot. In a lot of countries, they will say they don't use the vaccine.
You get any message where you want for send out there to the public?
Well, and I want just for tell the public say and the government and the Ministry of Health, with Honorable Minister Dr. Austin Dembi, we all they do everything possible for more get more vaccines so that the people then go get more vaccines. But we they also encourage people that may then take the preventive measures apart from the vaccine. May they avoid social gatherings, may they wash their hands, may they use their sanitizers. If they're not well, if you say you know where you get rash, report so that we'll be able to take adequate treatment instead of you then at the community, you dey spread to your loved ones and other. So if you know they feel well, please report and make we all as Sierra Leoneans they come together, make we be vigilant, make we report cases then so that we go stop this sick in this country.
And make we know say M-Pox day and M-Pox is real and it don't spread, fumble them. Then call we IB blog. We always they appear for the news. When me make it reach you, me na Ibrahim concept popularly known IB Fresh. Wanna continue for follow we for more updates.